Um, so welcome everyone for joining our session within the IACD's 24-hour global listening and sharing session. This is the title of our discussion today, Navigating Rare Childhood Disabilities, Empowering Caregivers Through Shared Decision Making and Decision Coaching. And if you would like to know more about the shared decision making at London Health Science Center, you feel free to scan this code, which I will be displaying once again later on. So just to give you a bit of introduction about today's session, it's a global session running with the theme of families who cares for them. And the London Health Science Center is present to you this topic of discussion for today and taking the next 1 hour. We would be recording this session, and we would like to have all of you on camera and listen to what you have to say and put your questions or comments on the chat. But if you do not wish to be recorded, or if you would like to remain anonymous, you can keep your video off and refrain from commenting on the chat, and you can feel free to rename yourself as participant. So we are collaborating on this hour with the International Alliance Academies of Childhood Disability, and the theme you see here is representing parents with lived experience and children and the Children's Hospital within the London Health Science Centre. I would like to invite Dr. Jacqueline Ogilvie, who is a developmental pediatrician at Children's Hospital LHSC and assistant professor in the Department of Pediatrics at Western University, who is also the medical director at Thames Valley Children's Center and faculty co-lead for the Social Pediatrics Curriculum Committee, to give us some introduction about what are the family-centered services at London Health Science Center, and I'll go ahead and introduce our panelists right after her. Jackie, please take over.
Wonderful. Thank you, Salamanesh. It's lovely to see everybody, and thanks for the opportunity to highlight a few of the additional programs here at Children's. You're going to hear about one of our great programs that helps support families and children, but I thought I'd highlight a few other ones in the quick time that we have. So one program is one that our Division of Developmental Pediatrics initiated a little while ago, and it's now in its third year. And it is called the Help Me Thrive program. And this is a interdisciplinary program to support infants who are experiencing prolonged hospitalization and coming back and forth to the hospital in those first 2 years of life. And we really do that through promoting infant well-being, infant attachment, caregiver bonding, with a lens of really trying to promote caregiver capacity and resilience in what is otherwise can sometimes be a daunting environment to have a little one. A big part of that has also shifted to become support for siblings too. So really taking that family's perspective when there's one child in hospital and perhaps some other little ones at home too. So that one we're excited for. It's in its third year and is continuing on. And in our first 3 years have supported, I believe we're over 100 infants at this point. Next slide. The next one, with probably familiar to some online here, but is our Pediatric Family Resource Center. And this is a staple. It is a place and a hub for resources for families. The staff here are excellent. They have lived experience themselves. They have intensive experience around community resources. And really, whenever I've reached out to them, there hasn't been a question they haven't either known the answer to or taken on the task of trying to figure out an option. They work closely with social work to try to make some of those community connections to really help address some of those health critical, but perhaps not core biomedical factors that are so impactful for families and children when they're coming through. Next slide. And the last one just to highlight is our child life specialist. So it's a children's hospital. Try to insert some fun where it can be found, and really have to have hats off to our child life specialists who try to live this all day. and support families and children when they are here, perhaps at some very scary times. So with that, there's certainly more programs and other ways that Children's Hospital is trying to provide family-centered care. And you're going to hear about another big landmark program here over the next hour.
Thank you so much, Jackie. That was really great insights to have. So I'll go ahead and introduce our panelists on this topic. And as Jackie said, we will be hearing about shared decision-making model, and we will hear it from parents as well. So our first panelist is Dr. Craig Campbell, who is the chair of pediatrics and the physician executive lead for the Children's Hospital. And he's the head of the division of pediatric neurology and the medical director of the multidisciplinary neuromuscular clinic based at Thames Valley Children's Center. He is also the head of the pediatric neurophysiology laboratory at Children's Hospital. He is a professor in pediatrics, clinical neurological sciences, and epidemiology at Western University, and a scientist at the Children's Health Research Institute. Dr. Campbell is collaboratively involved in many academic and industry-initiated clinical trial activities in pediatric neuromuscular disease. He has led the initiation of the Canadian Neuromuscular Disease Registry in 2011 and remains as the pediatric lead investigator. He is and 2015 from Muscular Dystrophy Canada and the CHRI Scientist of the Year in 2019. It's a great honor to have you here, Dr. Campbell. Thank you for joining us. Our second panelist is Bonnie Wooten, who is a registered nurse and a shared decision-making implementation consultant and decision coach at Children's Hospital LHSC. Ms. Wooten is an experienced decision coach who educates and encourages patients and caregivers to be active participants in shared decision-making. And I have permissions to use first names, so I'll continue with first names. Bonnie emphasizes that everyone benefits when patients and their caregivers are well informed and play a primary role in deciding how to treat or manage their own health conditions. Bonnie says, and I quote, "I believe that a well-informed patient is an empowered patient, and an empowered patient is key to a healthier future." Very true, Bonnie, and thank you for those strong messages, and I look forward to learn from you. Next, we have two parents with lived experience at our third panelists, Sarah Buchert and Peter Buchert. Mr. Buchert is the quality control manager for a construction company, and Mrs. Buchert is a stay-at-home mother. They are parents of two wonderful children, one of which was born with rare disease. It was their son's diagnosis that introduced them to the rare disease community and advocacy. They are both very passionate about finding supports for their family and families like theirs. The Buchert family say, and again I quote, "We needed to make a decision regarding our son's medical care and used the shared decision-making process to help us come to a clear conclusion. It was also a great way to involve our son in his care." It's such an honor to have you both here, Sarah and Peter, and thank you for joining us. Last but not least, our fourth panelist is also a parent with lived experience, Phil Singers. Phil is a senior business advisor at the London Small Business Centre and a proud husband and father of two children. He is a strong advocate for patient care, family advocacy, and neuromuscular disease research. Phil, along with the amazing support of family, friends, and Dr. Campbell, was instrumental in launching the William Singers Centre for Myotonic Dystrophy Research in London in 2005. Phil says, "Our family has utilized the shared decision-making tools firsthand. We found them very beneficial when facing challenges challenging medical situations because they allowed us to work through concerns and arrive at a decision together as a family. So we do have a very strong families here who are courageous and willing to share their experiences, and I'm looking forward to hear from them. Sorry, I didn't change Phil's picture there. So I'll stop screen sharing and proceed to see our panelists in full screen. Great. So welcome everyone, and so I'll just start by asking a few questions, and at the end, most importantly, we have some time for audience's engagement. So my first question I would like to ask Craig, can you please open the panel by describing what the shared decision-making model is? Craig, you are muted.
Thanks so much, Salamanish, for having me here, and for everyone who's joined. It was a very kind introduction you gave for me. But I will say one of the highlights of my career, and I've been fortunate to be able to do all sorts of neat things. But I will say, working with Bonnie and others to launch the shared decision-making program here at Children's Hospital still, really remains one of those key highlights for me. So I'm thrilled to be a part of this, and to start by, talking a little bit about what is shared decision-making, what is that model, because I imagine it will be a bit of a new concept for many of you. Having said that, I would say that people are doing shared decision making in ways in many of their interactions and in their journey through hospital settings here and around the world. Many of the elements of shared decision making are happening between you and your healthcare providers all the time. But what shared decision making, a shared decision making model does is allow us to have a more structured, careful way of navigating or making healthcare decisions. As many of you will know, in any decision, there's a person who's making a choice. They have to navigate or go through that choice, knowing their own preferences, their values, and ultimately they need to feel confident, in their decision. And then there's someone on the other side of that decision who's providing information, who has maybe a more objective perspective of the decision, and are trying to provide information and a knowledge of the risks and benefits. And that's really, in shared decision making, we try and make the best of both of those people on in the decision making process. So the decision making, shared decision making, provides a structured way for the patient so that they can have everything considered to feel confident about their decision, and it's structured such that the healthcare team has shared and provided all the evidence and all the knowledge about a decision in a thorough manner. Maybe an example is the best way to show this. You can imagine that in many situations, and I know that's the case here in Canada, but I know in many, many other health systems around the world, you can imagine being at a busy clinic where there's lots of patients waiting before and after you to see the healthcare provider. Let's say in this case, it's the doctor. The doctor's maybe running late. You have not only your child there who has a medical issue and you're trying to make some decisions about what to do, but maybe you have your two other kids there with you and they're not having the best day and they're running around the clinic room, and maybe at the last minute, your partner or someone you trust to be involved in decision makings couldn't make it to the visit, and so you feel alone there, having to make the decision. Maybe you didn't sleep that well yourself last night. Your kids were up, and everything's muddled in your head. You're trying to understand medical terminology. And it's in those moments that, I think all of us on every side of the decision making process would love a chance to, kind of hit pause and say, hang on, this is not ideal situation for making an important medical decision. And it's at that time that really the shared decision making paradigm, the approach, is most helpful. And that's really what we've done here at Children's Hospital, is provided that opportunity for anyone who's involved in that to sort of hit pause and say, listen, let's get some of the proper tools and some of the proper people involved to help us slow this decision down a little bit. Doesn't always have to be by much, and go through a more structured way of making sure everyone's heard properly through this process, and we come to a more careful decision making. And that's where things like decision coaching, you're going to hear from Bonnie. Bonnie can come in and help guide those decisions in a very structured, careful, systematic way.
Great, wonderful, Craig. And that is a really elaborative explanation, and I really think it gives a lot of insight to many of our audiences here, including myself. And so that brings us to talk about Bonnie's role as a decision coach. So Bonnie, please tell us what a decision coach is and what is your role.
Hi, thank you for setting this up. I too agree with everyone else that we appreciate having this opportunity. As a decision coach, I work with the patients, the caregivers, and the healthcare providers together to help them help the families make important choices about their healthcare. I work with the families to make sure that they understand the recommendations that are being made to them, that the risks and the benefits are accurately profiled when they receive them. I work with the families to talk about their options, to have an option chat that we can break down the pros and cons, the risks and benefits of their options, for them to consider what that looks like, and to see how they value those. Do they reflect their needs? Do they reflect everything that's important to them in their life? And especially for the quality of care for that child, that has to be kept top of mind. I think the process helps the patients and the caregivers learn about the risks and benefits of healthcare decisions through this process. It also helps the healthcare providers understand what matters most to the patients and caregivers about their values, their needs, their concerns, and brings us to a preferred decision. As a decision coach, I work outside I come to the family's objective. I'm outside the circle of care, so I'm not part of the discussion with the families and the clinics and the physicians about what they're recommending. So I am non-biased and come to them in a manner that says I'm here to have the discussion and care about your values and what you agree, what you're thinking about. So and through the process, of course, we use decision aids that I kind of talked about, making sure that they're profiled accurately, and we use other tools such as decision guide, a parent decision guide that has a lot of important information in it. And I think I'll just highlight that right now, is a tool that's used for people who are making decisions, helps identify their personal needs, their plans, their next steps. It helps them track their progress and communicate their views to others, because I do prepare them to go back to the healthcare team to talk about because I only do preferred decisions. I don't make decisions for families. The family is the final decision maker, and they take that information back and talk with the team about communicate their information and where they're at to the team. And it also, this tool helps them track other decisions or make other decisions in the future, because with these complex cases, this is only the first time. There are many other opportunities that they're going to have along their care journey to make decisions.
Thank you so much, Bonnie. And that really highlights your role, and it goes well along with what Craig has been raising, like the points around being in a busy clinic and needing someone to help you outside of that circle of care. And so it's really wonderful to have someone like you out there, Bonnie. So with this, I would like to come to Sarah and Peter and hear your experience as a family, and has the shared decision care model been helpful in your journey? Can you tell us a little bit about that?
Yeah, so our journey started when we were finishing up a clinical trial with our son, and we had faced some more difficult decisions. The referral went through our son's neuromuscular team. We reached out, or Bonnie got in touch with us. We started going through the pros and cons and did the research, and we got to that preferred decision as a family. It was very, very positive. It was relatively quick, and I agree with Dr. Campbell how it slowed it down and made it more methodical, and it just gave us a really, really good, confident decision. The second time we went through the process, it was self-referral. So we had Bonnie's information and we reached out directly to her. The topic the second time was regarding our son's medication. And so one thing that we did differently, we got our son involved in the process as well. So it was me and Sarah and our son with Bonnie, and we would go through the same process, the pros and the cons, the research, and having our son involved in the process gave us a whole new perspective and a whole new set of questions. And it was just super, super beneficial to go through that and include him as well. And again, we got to that preferred decision that everyone was on the same page. And yeah, so overall, the process has been very, very positive and has been, really, really good for us and our family.
Yeah, I just want to add too that adding our son to the second time was ultimately, he was kind of the driving factor as to getting to that preferred decision. So that was very interesting the second time around, involving him as well. And we were really hoping to have him take a little bit more responsibility as he's growing up and just taking a little bit more initiative into his own health too. So that was a really, really beneficial factor there.
Thank you so much for sharing that, Sarah and Peter. And I would like to hear from Phil as well. How has your involvement in the decision-making process affected your relationship with your family, your child's overall care, and with the healthcare providers as well?
Well, thank you, Solmesh. I mean, how has it helped our involvement with our relationships with our healthcare providers? I think it's done nothing but improve that, or allowed us to have a better understanding of the medical perspective and their side of it. I've often struggled with, or our family has struggled with balancing the medical the medical diagnosis and the medical strategies to deal with a certain issue, with trying to balance it with the family side and what we feel is in the best interests of our son. Our son is medically complex, has a number of different issues, and we first used this back in 2016. It was introduced to us by Craig pre to this shared decision-making committee, when we were facing a decision related to our son's spinal. He had a severe scoliosis in his spine, and we were facing whether we were going to have the spinal fusion surgery moving forward. And my wife and I were on sort of the opposite ends of the spectrum. I lived in more of the moment and what are we doing today and how is this going to help him? And I sort of, I was a bit of a short-term vision thinker, and my wife was a lot more longer term, and this is for the betterment of quality of life in a longer term perspective. And it wasn't so much the surgery that I was afraid of or questioning. It was the recovery and the impact it was going to have on his life moving forward. And I really struggled with it. Craig and I had many conversations. Craig referred me to other families that had gone through this process, and which was very helpful. I had spoken to the surgeons that themselves would do, the orthopedic surgeons that would do it. And then we introduced the shared decision making model that we took it through, and my wife and I went through it, and with Craig's support and help as well. It really sort of, I don't know, it was the tipping point. It really put me on the side of moving forward with this surgery at that time. I had no questions that we would eventually need that surgery, but I was sort of questioning that whether we needed to do it at age 14 for our son or postpone it for a few more years and so forth. So, ultimately we went forward. It was a very successful surgery. It was a long recovery, but it was successful. It has impacted his quality of life significantly in many ways. And, I don't know that we would have gone through that ultimately, at that time without that tool, which was, I don't know if it was very much in its infancy stages at that point. I think it was for us, for Children's Hospital here in London. But I think I know it's developed a little bit since, and obviously with Bonnie and team as well. But I've often referred back to that, and I've referred back to it as we've made more decisions moving forward. I mean, as parents of a medically complex now an adult child, it's you're facing these decisions many times throughout throughout a year, throughout the course of doctors and hospital visits and things. And I have leaned on it, and I found it very, very, very beneficial. And it helps me to get to a macro perspective. I mean, I think as parents, sometimes we're just living in the moment, and we're living right there and thinking in the short term without. Sometimes we need to just sort of step back and look at the holistic picture and the impact it's not going to have on our child and our family and our siblings and the overall care and our caregivers. So that's where I would sort of, say that's had that change in our relationships. So, and it's for the better. That's ultimately, which is what you like. So.
And thank you so much, Phil. You have highlighted a lot of challenges within that, and how as a family, as a parent, you would struggle to find a point where you could turn your head around and decide about something. And it's really powerful to hear that this was finally a positive experience for you, and I'm very happy to hear that. And I'll just want to come back to Sarah and Peter and ask, from your experience, what advice would you like to give to other parents who are just beginning to navigate the complexities of caring for a child with rare disability?
Yeah, I would probably just say don't hesitate to ask those really big, tough questions that, I know in the moment when you're in that doctor's office, I think Craig said earlier, you have a lot going on, maybe you didn't sleep well, whatever, later on, you'll think of these really big questions to ask, when it comes to treatment options, what are my options and what are the possible harm, the benefits to this treatment or not? And then, what kind of information is out there? Where else can I look? Asking these really big questions is very vital, I think. And then also to start trying to build your support network, that might be through the neuromuscular team, that might be, through the rare disability community, finding other families. I think Phil said too, connecting with other families that are in similar situations. So that's what I would, that's what I would probably say. Just and even searching for organizations and advocate groups for rare diseases as well.
Thank you so much, Sarah. Peter, anything you'd like to add there? And
Yeah, I just strongly agree. The biggest impact you can make on that is a good start. If it can be extremely overwhelming, but prolonging that, like if you don't start asking the questions and doing that research and looking for support, you just end up showing up late to the party type of thing. Like you're going to wear yourself out. It's going to be more stressful than it needs to be. Yeah, it's definitely very, very important to get going as soon as possible. And there's a lot of stuff online, right? Even with social media and support groups there's a lot of stuff out there. You just got to look for it and don't be afraid to go out.
thank you so much for sharing that. And with that, I just want to come back to Craig and ask, how do you envision the future of shared decision making in the context of rare childhood disabilities?
Yeah, I mean, I think what we've heard today and what we hear, over and over again is that these are, the decisions that people make are for their child are really, they're really difficult. They're really challenging. You do need to, to balance them out and think carefully through them. And I'm going to go out on, just a little bit here and say that, I think in our current healthcare system, it's not really set up very well for thoughtful, careful decisions, right? We're often very resource scarce. Again, I imagine this is, around the world, similar challenges. The hospital's always looking for, efficiencies. Let's get through things quickly. That's how things have set up. And so, we do need to create the space for, families to really be structured and methodical about their decision making. And that way, they do feel more confident, more knowledgeable. They often feel better then about following through on the decision. So, we talk about this concept of compliance with the decision, or, if you really feel you're engaged in choosing a certain medication, you're more apt to then be, take that medication and be involved in the, decision. So there's lots of, aspects that help by, kind of putting the pause on. I don't always like to say slow down, because we can do shared decision making very quickly. I mean, Bonnie's done consults in the moment. We call her and say, this family's struggling and it's an urgent decision. So shared decision making doesn't have to take forever and be set up next week or next month. With the right resources, it can happen, right away. I think those decisions that families are going to have to make in the rare disease space are becoming more complex. Children are living longer with sometimes life-limiting concerns, like life-limiting disorders that because we have better supportive care, better disease management care. So this means that there are many more decisions. And often the decisions are being more complex. We're seeing genetic-based therapies and gene therapies enter into the rare disease arena, and goodness knows those have often ethical and moral principles attached to them, depending on what culture you're in or how you feel about those things. Those are very complex. Does my child get a genetic based medicine put into their body? There's many more clinical trials for rare disease. So, thinking about, does my child participate in a clinical trial that may that may have a placebo involved? I mean, these are complex decisions, right? And so I think there is increasingly a role for structured, methodical, careful, shared decision making in rare disease and in kids with rare disabilities.
Thank you so much, Craig, for highlighting that. And it does, like, it's like you said, in our everyday life, we do face a lot of things that we need to make decision on, and we always look around for other people's support. And it's really great to have that in a structured way, and that does will help a lot to have it, to know that it is out there. Bonnie, with that, like, I would like you to give our audience an example of a particularly something that comes to your mind as impactful decision-making process you've facilitated over the time. You can give us one example, and we'll just open it for discussion with the audience.
Loaded question, complex. There are so many. I think the complex cases are probably the highlight of the type of referrals that I get. I want to, I can't identify just one that had impact, but I can say that for people that this might resonate with, in terms of here in our organization, we have an epilepsy program, and those children that come in with a rare disease and looking for elimination of seizures or reduction of them, when a parent comes into the clinic and they hear the physicians talk about, well, we're recommending brain surgery. Well, can you imagine as a parent what that would do to you, what that means? As Craig was talking about, it's overwhelming. They don't hear everything, even though the team is so good and excellent at explaining what the options are, how that surgery would look, explaining everything that they could possibly, the risks and the benefits. Families don't hear any of that. So they have to recognize that this family is in a position where they have to make a decision, and they offer a decision coach because the families have to agree to have a decision coach. It's just not an automatic referral. So I use that as an example, but there are some neuromuscular referrals that have been quite impactful as well. Again, I would go back to say that, it's those that are most complex, where this sort out everything that they've heard and to complete that. And like this morning, I just had one that was very complex and had at least 3 or 4 options that really weren't all great results, but you have to get to break those down so that the family has a plan and something that they can speak to with the team about. So that's how I would kind of respond to that. They're all kind of impactful, but the complex care ones are the highest.
Yeah, thank you so much, Bonnie. And I know there will be a lot of cases on your hand, and yeah, it will be hard to share one particular one. Craig has his hands raised, so
okay.
We'll open that to the audience with this.
I just wanted to add to that, because certainly Bonnie does help many families navigate really some of the most challenging decisions, right? Scoliosis surgery, G-tube, epilepsy surgery, whether to get a trach done, things like that. But I also, want to just make sure that everyone knows it's not always the most challenging decisions. It can be a very straightforward decision that a family or a patient is having a challenge with. So, right, there are people who struggle to make decisions, whether it be because they're anxious, they're depressed, they're dealing with lots of things. So sometimes even what the medical team may feel is a very, very minor decision with lots of benefits and little risk, a family can really, really struggle with that. And maybe it's about culture or health literacy. Maybe families aren't trusting of the healthcare system. There are times when actually the most straightforward of decisions become not straightforward for a family, and that's where Bonnie also has major impact. Like going through the decision coaching process can really help bring the empowerment back to the family that they were struggling with.
Just to add to that, if I may, because Craig reminded me, those families who live in different households that are there for their child, but they have differing opinions, that is another area that I would say is very impactful for this, to bring them together, to hear what each other has to say, to value each of their opinions and try to get to an option that they both agree to for the sake of their child. That's another very big area, I guess, as I sit here and think about all the areas. That's a big impactful, and people don't always think about that, but I do get a few of those as well.
Thank you so much, Bonnie. Yeah, so at this point, I would like to stop asking questions. I would like to open it to the audience. Please feel free to unmute and ask questions or put your questions on the chat, whichever you are most comfortable with. So meanwhile, I'd like to feel just if you could highlight a little bit more about like what were the common challenges you faced as a family when making decisions in line with what Craig and Bonnie has shared right now, and what support did you wish to have during that time?
Oh, great question. So, challenges. I think some challenges I still today is getting the right information. When you meet with your healthcare teams and healthcare providers, a lot of this is just verbalized, and a lot of it is presented to you, and you're in the moment with your family and your child. And some news might just be shared with you that, is not the best of news, and you're trying to hold your emotions in, and you're trying to support your child and support your spouse and other children and things like that. And you don't always get you get pieces of it. And at times I'm a bit of a information overload kind of guy. I want to get as much info as I can to make the best decisions, or help me reach the best decisions and speak to the right people that are going to help me make those decisions. So at times I wish, some of the challenges, I wish that sometimes when we're meeting with our healthcare team is to be provided a bit of a follow-up report, or provided some sort of written, okay, these are your options. Option 1, option 2, option 3. If you do option 1, you can do this. And a lot of this is verbalized, and I'm not saying anybody's withholding information. Again, as Craig mentioned, the healthcare system is very strapped for time. It's difficult. You got your 15-minute window there. But I think sometimes as a family, we struggle thinking that we're gathering all that information. Or we have all that information without, asking questions in that moment. And then, the other thing I would say, one of the things that really helped us is just leaning on the other resources available out there. Our team, we say we have a healthcare team around us, and it's not only the primary provider, but it's also the team of supports around us. I see Rhonda on the call through, with Thames Valley Children's Center and the team of social workers there that were so supportive to us and our family. The nursing teams, the other, the OTs, the PTs, the teams, the people that are sort of behind the scenes that are can be so resourceful and so helpful as well. So, to ask your question, what could have been different? There's always things in hindsight that you could change or wish that would be different. I think, and that's probably one of the reasons I'm on this shared decision-making committee, is to try and, make a bit of a difference, help improve lives for future families and others that will use this tool. And just try and provide more resource and information for them so they can advocate for their children as best as they can to make the best decisions possible. At the end of the day, that's what we want as family members. We want to make the best decisions possible for us and our family. That might be contrary to what our healthcare providers are saying. or it might not be what they like to hear at that time. But if I need another couple of weeks or another month to reach that decision at times, and I lose a bit of a spot, so be it, as long as it's not life crisis. I know Craig mentioned earlier, sometimes there are very critical decisions that need to be made in the moment or within a very short period of time. But so.
Thank you so much, Phil. That was very insightful. There is a question in the chat from Dr. Darcy Fellings. Thank you for a very engaging discussion around shared decision making. My question, do you have ideas on how we can support clinicians or physicians to embrace shared decision making in their interactions with families? Who would like to take on this question?
Do you want it, Craig, or do you want me to talk a little bit about it?
Go ahead, please.
I think this is a question that I often get asked, and it does get asked around how do you make this happen? How can you support it? The factors influencing engagement are multiple, right? Multidimensional to get people to engage. I think it really, some of the influencers are the patients themselves, their beliefs, their role, their health equity, literacy, education level, all of those things impact from that perspective. And the organization for clinicians and physicians to embrace the organization's policies and their practices and their culture play a big role. Are they ready to do this? Do they think this is important? Even in our society norms and our regulations and our policies that guide decisions that are impacting our organizations have an impact on how to embrace shared decision making. But I think sometimes people are thinking that the clinicians and the physicians, healthcare team think it takes a lot more time, but it really doesn't. It is part of what you do in your clinic all the time. Engaging them, I think what takes the time is if they're struggling with a decision and who on the team has the time to have a one-on-one or take an hour out to break down the discussions. That's where it seems to have the capacity of the team seems to struggle with that. And so that's why why we have this service, so that you can bring in someone like myself as a decision coach to work with the clinicians and the physicians to educate them on the value and how they might be able to do this effectively in their teams. I don't know if Craig wants to add more.
Yeah, no, I think those are great to answer. I mean, Darcy, our program involves a toolbox of that clinicians can go and find decision aids and decision guides to use in their practice. Unfortunately, in pediatrics, as you probably are aware, we don't have a lot of formal decision aids. Those are often built and created in evidence-based ways in the adult world. So in the adult world, they have a lot more discrete decision aids. But where we have them, we've put those in a toolbox for people. We do a lot of education and awareness seminars for different physician groups. But ultimately, I think, as Bonnie said, a lot of healthcare providers feel that they don't have the time, and that's where I think the impartial decision coach model that we have here at Children's Hospital and TVCC, where someone, if they're realizing that things are that the decision making is not ideal and not optimized, they can fill out that referral to Bonnie, or a family can self-refer and say, listen, let's do this better. Let's optimize things so everyone comes out the other end of this decision. And then Bonnie can come in as an impartial person and really guide through. And I think really that's, to be honest, I think certainly the way our system is right now, that's probably the most the easiest way to support clinicians and physicians in their interactions with families.
Thank you so much, Craig, and thank you for touching on the referral pathway as well. Like I was suspecting that might be a question, and there was a question related to that, which was directly sent to me as well. And there is a question for you, Bonnie. But before I read the question, I just wanted to hear Sarah's and Peter's opinion about this. Like, how can the healthcare system better support shared decision making for families? What do you think should be better? Sarah.
You know, I was just thinking as Bonnie has been talking and Dr. Campbell has been, and it's kind of difficult to come up with anything that needed to be to be improved. Like thinking back on our first and second experiences with this, I would have to say that everything went so smoothly. So I'm not sure that in our particular situation that I could say that anything really needed to be improved other than I think it was Phil that mentioned maybe more of like a follow-up type of thing. You know, if all of a sudden we needed more time or something like that, then that was given. But I think Dr. Campbell was the one that also said that sometimes you need more time and it doesn't have to be like this really, really quick decision either. So maybe slowing down the process in some cases and explaining things a little more thoroughly. I know in the moment you can feel really overwhelmed with a lot of information. So yeah, maybe just slowing down the process. But in our experience, I would say that everything worked out so flawlessly. We have no complaints.
Thank you so much, Sarah.
Yeah.
And that was a great experience to hear about. So Bonnie, there is a question from Bernadette. She's asking for you to give a brief example of shared decision making that you had with a family and walk us through how this process may work. Sorry, Bonnie, you're muted. I can't hear you.
Sorry, say that again. You're looking for what again?
Give a brief example of shared decision making that you had with a family and sorry, just having that you had with a family to walk us through how this process may work.
The referral works where
The process.
the process works. The family has to they decide that there's a decision to be made. They're offered a decision coach because they have to agree to it. And then together, I get the information from the team who's making the referral on what the decision, what the recommendation is, and what the barrier to moving forward, the decision making they're struggling with. From there, I make contact with the family. I set it up. Most of my consults, practically all of them now, are by remote. So it doesn't matter where you live. You don't have to travel back here to London, or if you're someplace else in the province. We have accepted other referrals from outside of our area. The time and date is set up through the parents, what they feel would work for them. And through remote, I work through using the decision guide, and we set up the issues that or what they're facing, the decisional conflict that they're facing. We do a lot of reflection on what they heard, what they understood from the team, what information they have, and if there's something that's in conflict, I clarify by saying, this is what I understand, this is what I got from the medical team. Did you hear the same thing? So there's lots of reflection because people hear different things at different times. So I'm there to validate the information that they were given. And then through that process, we go through risk and benefit. The referrals can take up to an hour. They can take 30 minutes. It depends where the family is in their decision making, because sometimes they've been able to work through once they've left the clinic and they've gone home and they've thought about it, or they've talked with others. The plan seems to slip into place, but we talk it through if they haven't made a decision, and we take it slowly. Sometimes it takes more than one referral, more than one time. Sometimes they ask for risks and benefits that I haven't been given. I'm not the expert, so I depend on the team to give me the expert information. And if I don't have it all, then I have to go back to them or refer to my partner, Dr. Campbell, to help me out with any specifics on that. And then we get to a preferred decision by the parents, by both. And that's what goes forward to the team who made the referral. And then the parents have the responsibility to contact the medical team, the most responsible player, and give them their final decision, because that wouldn't be the final decision. It would be a preferred decision. So I do prepare a consult that's reviewed and signed off by the lead physician who is responsible for the referral. And I don't carry a caseload. It's left for them to contact with me and refer back. I don't know if that's what you're looking for, who asked the question. Is that kind of the process you were looking for?
Very helpful, Bonnie. Thank you.
Yeah.
Okay.
Thank you so much, Bonnie. And being mindful of the time, we only have less than 3 minutes. I just wanted to give the final minutes to our families and hear in the context of support, how to best support families. If you have any final message you want to send out to families outside there who didn't have access to such services. Sarah and Peter.
Sorry, so the question was,
if you have any final message that you would like to pass on to families who are out there who doesn't have access to such services.
I guess it would go back to, again, like it's been mentioned a few times, to in the moment you're taking on all that information, but and it is very much dependent on each individual situation, but it's very beneficial to reach out and you can do something similar even with family members or the healthcare team that you have. If the shared decision making isn't available, it's still a conversation that you can have with your healthcare providers, right? You can still go back to those difficult questions, get the pros and cons, get all of the options, the benefits and the potential harms from those options. It's still a conversation that the parents can initiate and drive with the healthcare providers that they have.
I agree with that. Yeah.
Thank you so much. Yeah. Anything you'd like to add, Phil, or?
Yeah, no, I would just echo what Peter said, and then I'd sort of go, if it's not available, and I'd ask your healthcare provider why not, and I'd direct them to us and LHSC and the team here, and let's this should be available to everybody in Ontario, across Canada, and I don't see why it shouldn't be. So it's last message, or I don't know, final message, but to parents and families out there is, don't be afraid to ask questions, don't be afraid to ask, advocate, and don't feel that you have to make a decision in that moment right there in that office. Take your time, and make the best decision, informed decisions that is in the best interest of your family.
Thank you so much, Phil. And there is a question around sharing the toolboxes from Darcy, and we promise to share those through the registrant email. So I will send those from Bonnie. Thank you so much all for joining us today. There are ongoing sessions through the International Alliance. Feel free to check the website and join other sessions. Each session is for 1 hour. Thank you for joining our session. We will end it here. Thank you.
Thank you, everybody.
Thank you.